This is Dr. Manjunath, consultant urologist and andrologist at NE Uroconnect Clinic, Raichur. Today I will be talking about pregnancy and their association with renal stones. So we have seen few patients coming to my clinic asking, sir, I am taking calcium supplements. Will it increase my risk for stone formation in the kidneys? So the answer to this is no. It's just a myth. So whatever the calcium supplements that are prescribed by obstetricians, they are in general therapeutic range, and there is definitely increased need for calcium, calories and also protein during pregnancy, which is well supplemented by our gynecologists. So, and it is given for a short time of period, maybe 9 months, maybe 1 year, depending on the post-op status. So that is not harmful to your risk for kidney stones. Second thing is, then is there any risk factor as such pregnancy itself is a risk factor for stones? The answer to this is yes, because there is something called as physiological hypercalciuria in pregnancy. Generally everyone tends to excrete calcium through urine, but in pregnancy there is increased, whether you give supplements or no, there is increased excretion, which is again a risk factor for kidney stone formation in general. Second thing is we something called as physiological hydroureter nephrosis. The gravid uterus, the pregnant uterus, presses on the ureterus, especially on the right side. So there is little stasis of urine, which is a risk factor again for kidney stone formation. So presentation is largely the same. Kidney stones are again silent most of the times. Also, these patients will be sometimes having pregnancy stones, which are diagnosed during pregnancy when they do maternal scans. So kidney stones presentation again can be asymptomatic, can present with pain. Sometimes if it obstructs the ureter, the tube that carries from the urine from kidney to stones, there may be risk for infections. Some patients we have seen landing up in sepsis, urosepsis, infection, pyelonephritis, all those features. So management part generally is we try to do conservative management, because pregnancy nowadays most of the pregnancies are precious pregnancies. So largely we will try to do on conservative by giving medications which will help the stone pass out fluid, hydrations. Suppose a patient is having sepsis, like maybe pus formation, severe intolerable pain, not responding to painkillers, because we have a limit for usage of painkillers also in pregnancy. So there is we cannot do CT scan to confirm the stone. Very rarely, sometimes we may have to do MRI also. So we try to be as little intervention as possible. So whenever there is a need of intervention, we try to use as many less energy devices as possible, because the lithotripsy that we use can cause premature abortions. So, but generally second trimester means from 13 week to 28 weeks is a safe period for any surgeries. So we try to just put a stent, DJ stent. So these stents will help us relieve of the obstruction, any pus drainage will be there. So kidney stones are tackled later. So pregnant women, if they have stone, not like compulsory surgery has to be done, whether it will affect the baby's health, just consult a urologist. Don't neglect for it to sometimes complications because of this ureteric peristalsis may stimulate ureteric contractions also, ending up in premature deliveries. So management will be, we try to do as minimum intervention as possible. So please consult your urologist when there is hydronephrosis, kidney stones during pregnancy. Thank you.